Good morning, I'm Dr. Ravi Teja, a postgraduate from the Department of Pulmonary, Narayanamedicalcollege and Hospital, Nellore. I'm here today to talk to you about COPD on the occasion of World COPD Day, which is celebrated every year on the third Wednesday of November, and this year it is being celebrated on 18th of November. Ask a friend or a family member about hypertension, diabetes, cancers, or even coronary artery disease. They may be knowing a thing or two about these diseases. However, ask them about COPD and there is a very slim chance that they may actually know what the disease is all about. And yet, COPD continues to be the third leading cause of death worldwide. So what exactly is COPD? COPD is the abbreviation for Chronic Obstructive Pulmonary Disease. The chronic in the name states the long-term effects of the disease leading to disability and even early death. The obstructive part deals with the pathology of the disease in which the airways become inflamed, thickened, filled with mucus, leading to affecting the movement of air into and out of the lungs. The air sacs or the alveoli, which take part in the gas exchange process, lose their elasticity, and this adversely affects the gas exchange process. So why should the patients and the general public be concerned about COPD? COPD remains largely under-recognized in developing countries like India, where a majority of the rural population is inaccessible to comprehensive healthcare. As of 2016, COPD was the second leading cause of death in India, and latest trends show that these numbers are more likely to increase in the next 20 years. However, the prevalence of COPD is widely underreported, partially because of misdiagnosis and partially because the patients tend to present late after ignoring their initial symptoms. It should be noted that COPD is not just a disease of the lungs. COPD is a systemic disease affecting other organs both directly or indirectly. In addition to disability and loss of quality of life, COPD can be a major economic and social burden on the country as well as the patients. There are many risk factors which can contribute to COPD, and smoking, both active and passive smoking, is a major risk factor contributing to COPD. The other risk factors include occupational exposure to dust, chemical agents and chemical fumes. In India, particularly in women, indoor biomass fuel exposure is of a particular concern. Untreated asthma and previous history of tuberculosis may also predispose to COPD. So how do we diagnose COPD? COPD can be diagnosed based on symptoms and based on spirometry. It should be considered in any patient with dyspnea, chronic cough with or without sputum production, with a history of exposure to risk factors including family history as well as childhood risk factors. The dyspnea in COPD is persistent, progressive, and it worsens on exercise. About 30% of the patients present with cough with sputum production. Wheeze and chest tightness are also seen in COPD patients, and patients with severe COPD, they show weight loss, anorexia, and fatigue. Spirometry is the single most important diagnostic tool for the diagnosis of COPD. It is the most reproducible and objective measurement of airflow limitation. Spirometry can also be used to assess prognosis, treatment adherence, and follow-up. So once we have diagnosed COPD, what are the various treatment options available to us? Recently, a number of newer drugs along with drug delivery devices have become available, and physicians all around the world, they tend to lean more towards pharmacological therapy as the sole treatment of COPD. However, the disease has much more to offer, and this brings us to the theme for this World COPD Day, which is living well with COPD, everybody, everywhere. COPD should not just be considered as a single entity, and other preventive aspects have been acknowledged like smoking cessation, vaccinations, mental health, and nutritional supplementation for the complete well-being of the patient. Smoking cessation is the key to COPD prevention. Individual counseling encouraging the patient to quit smoking, legislative smoking bans, and using nicotine replacement products can help prevent COPD. Vaccinations including influenza vaccinations and pneumococcal vaccinations should be recommended in all patients in order to reduce frequent infective exacerbations and to prevent serious illness. Another most important and the most frequently forgotten treatment aspect of COPD is inhaler compliance and inhaler technique. A number of inhalation devices like nebulizers, dry powder inhalers, meter dose inhalers, and soft mist inhalers are available for patients, and each device has its own advantage and disadvantage. The choice of inhaler device has to be individually tailored depending on the accessibility, cost, prescriber, and most importantly on the patient's ability and preference. We must make sure that the patient's inhalation technique is adequate during each visit. Pulmonary rehabilitation is a fairly new treatment concept, and it is a comprehensive intervention which is based on thorough patient assessment followed by patient-tailored therapies, which include exercise training, education, self-management interventions aiming at behavioral change. Pulmonary rehabilitation improves oxygenation, it improves dyspnea, it reduces hospitalization, and it reduces anxiety and depression. Another important aspect is nutritional supplementation. As we have seen earlier, nutritional supplementation is important to promote weight gain. It is important to improve the respiratory muscle strength and to improve the quality of life, as low BMI and low fat-free mass are associated with very poor outcomes in COPD. Studies have shown that patients with COPD suffer from depression at some point in their life, and approximately 2/3 of the patients with COPD suffer from moderate to severe depression. Depression and anxiety are associated with poor health status. So regularly screening the patients for depression, cognitive behavioral therapy, yoga, and encouraging the patients to talk to their healthcare providers can help reduce anxiety and depression and improve the quality of life. So finally, patients should be encouraged to talk to their healthcare providers, and we as healthcare providers should adopt a more multidisciplinary approach in order to provide for a better accurate diagnosis, to appropriate pharmacological therapies with inhaler technique, promote smoking cessation, promote nutritional supplementation, promote regular vaccinations, and mental health support. All these correspond to the theme for this year, which is living well with COPD, everybody everywhere. And if you know a person with COPD or is showing signs of COPD, talk to them, encourage them to visit their healthcare provider, and assure them that they can lead a better quality of life in spite of the disease. Thank you and stay safe.